As California eases restrictions on elective treatments and surgeries, there are thousands of doctors and dentists that are starting to see patients again. But what is this going to look like? Dr. Sung Wong from the Vein Clinic in Santa Barbara is joining us live via Zoom this morning. Good morning, doctor. Thanks for joining us. What are you doing to prepare for patients again?
So it's obviously really important that we maintain a safe environment, not only for our patients, but also for our staff. So all the staff members are wearing masks and proper PPE. We have hand sanitizer gel at the front desk in each of the rooms. We're staggering the appointments to allow more time to sanitize the room, not only just the patient surfaces, but door handles, bathrooms, countertops, etc. We are also arranging the waiting room. Most of the time, you should be able to walk straight from your walking in straight back to a room. But if for some reason you have questions or there's something to be done, you'll have the waiting room to yourself. Some of the doctors might have to space out their waiting room to allow more spaces in between. And I did hear a couple of the doctors saying that they would ask patients to stay in their cars and to come in when they're called to decrease the amount of space in the waiting areas to increase social distancing.
Interesting changes that we're seeing, and it's not only maybe waiting in the waiting room, but you're trying to do some things via, like we're doing right now, talking over Zoom. You can do a lot of things like that as well, right?
Absolutely. And in fact, in the last 8 weeks, most of our appointments have been all virtual telehealth appointments. With people having to wear masks and being indoors, they've had more interest and they've been researching more of the less invasive treatments that they can get once this shelter in place is lifted and they're able to get these treatments.
And from the patients that you've heard from, are they eager to get back and do some of these elective type surgeries? Now, they may still be necessary surgeries, but are they eager to come back in and finally be able to get them done?
Absolutely. We've had a huge amount of interest, especially in the last 2 to 3 weeks, of patients who are curious about what they can do, people who have been waiting to get things done and now find the opportunity to do so, both in the invasive, in the ORs, but also much more so in the less invasive aesthetic treatments.
Dr. Wong, thank you so much for joining us this morning. It's a new world that we're all in when it comes to figuring out what's going to be happening when you go into a doctor's office now. A lot of people haven't been in there yet, so we appreciate you joining us and explaining that about what we're going to be seeing. Thank you so much.